how to determine the side of the clavicle. That is also very important, right? First you see this is the medial end, it is quadrilateral end, and this is the lateral end is flat, almost flat. Okay, these are the two ends. Next, this is also called medial end or sternal end, and this is also lateral end, or this is also called acromial end. Acromial end, because this part here it articulates with the acromion process of the scapula and takes part in the formation of acromioclavicular joint, right? Why it is called sternal end? Because this is the clavicular notch of the sternum. It articulates with the clavicular notch of the sternum. Then it takes part in the formation of sternoclavicular joint. Sternoclavicular joint. Okay, so these are the two ends of the clavicle. One is the lateral end, another is the medial end, and this is also called medial end is also called sternal end. Lateral end is called acromial end, right? Next, how to keep bone in anatomical position. That is a very important point while keeping the bone in any bone. If you go to the anatomy exam, or most of the examiners, they ask how to keep this bone in anatomical position, right? First you have to identify the medial end and lateral end by its features. Then you observe the this part is called shaft. This part is called shaft of the clavicle. Okay, this is the shaft of the clavicle. If you keep the shaft here, if you want to keep the bone in anatomical position, first you see the shaft. The shaft must be convex. That is convex medial 2/3 on concave lateral 1/3. Medial 2/3 is convex, lateral 1/3 is concave. That is one point you remember. And if you see the clavicle under surface or inferior surface of the clavicle, you will get bony landmarks. Here you see. Here you see this is the one small projection, bony projection here. Okay, this projection is called conoid tubercle. Then it is followed by a ridge here. You see, this is the ridge. This ridge is called trapezoid ridge. Conoid tubercle and trapezoid ridge. They are present in the inferior surface of the lateral 1/3 of the clavicle. Lateral 1/3 of the clavicle. Here, this is the conoid tubercle and this is the trapezoid ridge. That is one important point. Next, you see in the middle of the shaft of the clavicle, inferior surface, it presents a groove, or you see this area, depressed area. This is called subclavian groove. Subclavian groove. The subclavian groove, it provides attachment or insertion to the subclavius muscle. Subclavius muscle, it is a muscle, small muscle, triangular muscle. It takes origin from the first rib, then it gets inserted into the clavicle, especially inferior surface of the clavicle in the middle third. Then in the subclavian groove. Okay, that is another important point. You must keep the subclavian groove below, and conoid tubercle and trapezoid ridge also below. And then you can see here in the medial part, here you will get another small depressed area or articular area. This rough area, it provides attachment to costoclavicular ligament. Costoclavicular. Costo means rib, costal cartilage to the clavicle. Here there is one ligament that is called costoclavicular ligament. Okay, these 3 points you must remember: conoid tubercle, trapezoid ridge, subclavian groove, and costoclavicular ligament attachment area. This rough area, it must be inferior. And this anterior 2/3 and anterior surface is medial 2/3 is convex, lateral 1/3 is concave. You see here, this is convexity and this is the concavity. So if you keep like this and expanded medial end, that is a sternal end medially, and flat end or acromial end laterally, with the help of this one, you can determine the side of the clavicle, right?